Hi, my name is Chris Karstens, owner of Orthopedic Solutions in Alton, Illinois, and I'd like to demonstrate the proper application of the K-67 hybrid knee brace. But first I want to address the two measurements that need to be taken on the leg to ensure a proper fit of the brace. The first measurement, have the patient fully extend the leg and take a circumference measurement right at mid-patella in inches. Once you have that measurement, document that, and then measure 6 inches proximal up the thigh, and also take, at that point, a circumference measurement in inches. Take those two measurements and reference your sizing chart, and then that will determine what size brace the patient will need. First, I'd like to also discuss what makes this brace so unique. It addresses a specific problematic patient, and that is the patient that has a very large thigh. As you know from experience, if you've ever fit knee braces, if you have a patient with a conical shaped or funnel shaped thigh, a lot of adipose tissue, most pull-on knee braces, it just doesn't fit properly. The brace is rolling outward, you're getting gapping, it's cutting into the soft tissue. If you have an all anterior closure knee brace, it's another problem. They still don't fit adequately, and also you'll get gapping around the patella. This specific brace, again, addresses that specific problematic patient. With it being wraparound up at the thigh and the distal part of the brace being a pull-on, you're able to ensure a better fit around the entire structure of the leg. Let's show you the brace. First, take the upper strap around the thigh and just undo it, set it aside, and do the same with the distal part of the brace that goes around the anterior shin. Just set that off to the side. Open the brace up, have the patient slip their foot through it, and as you'll notice, there's two boot straps, one for the finger on each side, and have the patient just reach in and pull this up just below, comfortably below the patella. Once it feels comfortable and it's in position, have the patient take the upper part of the brace, the wraparound, and then they can surround that conical shaped thigh better and more comfortably. I do want to mention before I secure this, another unique feature to the K-67 is the fact that it has a buttress on the medial and the lateral sides. Most anterior knee braces do not have a buttress. It just wraps around and all you have are hinges. This makes another benefit to the K-67, so if there are some patellar tracking issues or it just needs to be surrounded for a more comfortable fit, you have that option right here and adjustability. Back to the proximal part of the brace. Let's secure this down. And before we do this, the strapping, I want to point out the hinges on the medial and the lateral side. It's very important that these hinges on the proximal side only are adjusted in the coronal or frontal plane, which is the anterior posterior plane. If you noticed a patient, once you fit them and they're in the brace, and you notice that the hinge is maybe too far posterior, we can undo this. Again, a unique feature to the brace, and just move it posterior out of the way and undo the medial side, and then move it out of the way. Now we can adjust accordingly in that coronal frontal plane, ensuring, and make sure the patient's leg is fully extended when we're making that adjustment. Secure that down and do the same for the medial side. Full extension, secure it down, and you're ready to go. Now you can secure your strapping through the D-ring and around and secure. Also, the distal D-ring, secure and counter pull. Notice the front part of the straps are static. There's no elasticity. However, the posterior straps, you'll notice that there's some elasticity here, both at the distal end as well as the proximal end. And that is for the purpose of a more comfortable fit for the patient all day while they're wearing the brace. Let me mention, as the patient all through the day is either sitting, going into a standing position, all the muscles in the hamstrings start to fire. They expand. Also at the calf area. That can take place as they go into a seated position. They start to fire. If you have a non-elastic or unstretchable strap, it's just static, in the posterior region. As those muscles fire, the soft tissue expands and it cuts and it's restrictive into the soft tissue. By having it be elastic, it allows expansion as those muscles fire. Again, ensuring all through the day you get a much more comfortable fit. You'll just lay those and secure them down. They don't have to be tight. That just lays across here and you're good to go. Again, this is the application of the K-67. Very, very simple. If you have any questions, feel free to get a hold of your local representative and inquire. Thank you very much for your time.